Southwest Human Development was founded in 1981 by early childhood professionals who recognized the need for comprehensive and coordinated services for children from birth to age 5 and their families. We strive to give all children the healthy foundation they need for an optimal start in life by discovering gaps in available services and providing high-quality solutions. We do this because research tells us that children's earliest experiences shape all future development. So today, Southwest Human Development is Arizona's largest nonprofit organization dedicated to early childhood development. We serve more than 135,000 children and their families each year. Southwest Human Development strives to give all children the healthy foundation they need for an optimal start in life. To achieve that, we serve families facing a variety of challenges through more than 40 programs with services focused on child health and development, Easter Seals Disability Services, child welfare, Head Start, early literacy, and professional education and training for early childhood professionals. To better serve young children and their families, we need support from local, regional, and national partners and donors to not only increase awareness about the services we offer, but to also provide greater access to resources for the families we serve. As Arizona's largest nonprofit dedicated to early childhood development, we recognize that a child's earliest experiences and relationships establish the foundation for all future development, which is why we focus specifically on children from birth to age 5. This includes focusing on a child's intellectual, social, emotional, and behavioral development, and working with their families on a plan that will best work for their environment. We leverage proven research, along with our relationships throughout the community and the expertise of our staff to meet the unique needs of the families we serve. Fulfilling our commitment to young children means more than providing programs and services. It means having a true understanding about the challenges that young children and their families are facing and how we can best help them succeed now and in the future. That's why our early childhood professionals provide research and evidence-based programs. Each of our programs is designed to help prevent problems before they arise, or when problems already exist, intervene as early and effectively as possible. We meet families where they are, ensuring that services and solutions we provide meet their needs in their environment. We partner with organizations in the public and private sectors to share information, provide training and expertise, and really do everything we can to ensure comprehensive and coordinated services for young children and their families. With more than 40 different public and private programs, the metrics we use to evaluate each of them can vary. Southwest Human Development as a whole uses a strategic plan that is developed, evaluated, and maintained by our agency's leadership and board of directors. This annual plan includes a variety of objectives, goals, and benchmarks to ensure that we are continually meeting the needs of the young children and families we serve each year. And each of our programs are routinely evaluated in order to ensure quality and determine their effectiveness. We also follow established metrics by legislators, such as Arizona's new law that requires all children to be able to read proficiently by the 3rd grade. In order to meet this new standard, our early literacy programs are focused on children ages birth to 5 in order to prepare them for school success. At Southwest Human Development, we find that people may not be aware of the full spectrum of services that we provide for young children and their families. For example, someone might know about our services for children with disabilities, like our Children's Developmental Center or Good Fit Counseling Center, or they might know about our early literacy programs, like Raising a Reader and Reach Out and Read, but they don't realize that they're all within one organization. Another misconception is that we only serve low-income families. Many of our services are open to all families and early childhood professionals as well. At Southwest Human Development, we pride ourselves on the ability to recognize gaps in early childhood services and fill them. In many cases, this includes adding programs and services that aren't available through other organizations, or adapting existing research-based and proven programs to better serve our community. Also, Southwest Human Development and its employees are regularly recognized for their work in the early childhood field by local and national organizations. These awards have ranged from Best Places to Work to a variety of other awards recognizing the work of our agency leadership and programs. As with many nonprofit organizations, Southwest Human Development has not been immune to lack of funding. Whether that be federal and state budget fluctuations or decreases in philanthropic giving, Southwest Human Development has had to be resourceful in order to continually meet the needs of Arizona's youngest children. And the number of children needing services like ours continues to grow. Southwest Human Development has also struggled with brand awareness over the years. While many in the community may be familiar with our individual programs, the fact that all of those programs are under one roof is sometimes lost. We are always looking for new and creative ways to increase our brand awareness. For Southwest Human Development, access to additional resources truly means creating a positive future for young children and their families. Our agency is currently only able to serve a small percentage of the population who are in need of our programs and services. With more than 40 public and private programs available, additional funding and resources would expand our reach into the community. For example, by providing early literacy programs in neighborhoods we haven't reached yet, or reducing waiting times and lists for our developmental, education, home visiting, and mental health services. Every bit of help can really mean a world of difference. With the population we serve, children from birth to age 5 and their families, our goal is to expand in every direction we can. We're looking to provide more Head Start and Early Head Start classrooms in neighborhoods, bring early childhood services to our most at-risk families, fund early intervention and mental health services, and provide more help for foster families who struggle financially. In a perfect world, we would be offering family support to anyone who needs it across Arizona.